James Mahalek, orthopedic spine surgeon here in Kearney, specifically affiliated with the New West Sports Medicine Orthopedic Surgery Group. I've been here in Kearney where I grew up, and I've been in active practice for about 13 years. I remember first hearing about OrthoDirect through John Rule. We had worked together very closely over the years at Good Samaritan Hospital, and John had approached me at one point and said, you know, I've been on the industry side as a rep for Globus and now as a coordinator for the orthopedic and neurosurgical service lines at the hospital. I think there's a better way to do this. I think there's a way that allows us to be good stewards of the resources, healthcare-wise, finances, but yet still make sure that the patient care remains priority number one. He initially had talked to me about what I call dumb technology, burrs, blades, just the standard stuff that comes across the hospital that's pretty unemotional from the standpoint of surgeon usage. But then after talking with John about it a little bit more, I came to find out that, you know, there's a great opportunity here from the specific standpoint of spine surgery when it comes to implants. Originally, it seemed to me to be strictly a numbers game. It was, here's a great opportunity to save a hospital a bunch of money and be a part of that. The biggest change to me has been personal growth. It's been this leadership role. It's been in alignment with the hospital and camaraderie with the people that I work with daily, where we've gone from the role of typical surgeon, loudmouth, and his subordinates to being more really a collegial team. We see each other now more as colleagues than we do subordinates or directors or superiors. That's been really exciting. Friendships have evolved out of it, and feel like we operate much better and more efficiently when we're working toward the same goal. The one area that I was completely shocked by was how much better my relationship with Sterile Central Supply got. And that was great because that can be a real thorn in your side as a surgeon when you don't have great confidence from the people who are critical to the role of making sure everything you need is available and it's regularly sterile and available for you to use. So reinforcing that relationship was a big win for us. There's a few challenges. Change is difficult. It gets resistance. It's tough to be an innovator, and I'm not really labeling myself as an innovator. I call you guys more of the innovators, but I would call myself an early adopter. And the first challenge has been hospital administration, and thankfully in Kearney here, that's been embraced pretty well. It makes sense to them. I wasn't really ready for some of the resistance I've seen from some of my professional colleagues. I thought that it seems as though they divide into two groups. People that are, hey, how can I be a part of this? I love what you're doing. And it's other people who, I think this is nothing I want a part of, or I don't like the idea. The third part being the industry, probably the most challenging hurdle, because there are some long-term relationships and friendships that can be fractured or at least challenged by this new model, a direct model. I think that, you know, they see threat and fear, and it sometimes comes across as being obstructive to our goals here. I think that's really easy. I think as long as we maintain people like myself and John Roll who are championing this process, the most important role is going to be the OrthoDirect technicians and experts that we've identified and bringing them up in the role that we want them to take on. I think when we have those people bought into the process, there's nowhere else for it to go other than success. Number one, financial. We are seeing patients every day who are asking us about the cost of their care, and although a good number of patients that are insured will meet their deductibles and their out-of-pocket costs, as those costs are transferred increasingly to the patient, they are becoming more savvy consumers, and they will care if they can save tens of thousands of dollars on care that's equivalent. The other side of it is more intangible. It's the general happiness of the team and the efficiency with which their care is provided. That's a huge benefit. It's one you can't put a dollar number on, though. Yeah, the physician's directly involved. Big benefits, again, from having a team that you've grown close with and are operating at an efficiency level you've never seen before. When an institution that you're helping drive value for is successful and they're able to retain a significant portion of savings that was leaving their door before, some of that money's coming back. It's coming back in equipment, it's coming back in capital purchases, it's coming back to reward the staff that have worked so hard. And all of that leads to, growth of your service line and development of what you love to do. It's been difficult because, oftentimes surgeons feel like they're at odds with hospitals. This provides us kind of a way to join hands and move in the same direction, kind of our kumbaya moment. I think that you do need to have a physician that's open-minded enough to feel like they should function as a good steward of the healthcare resources. The mechanism that's in place for purchasing implants for orthopedic procedures like I perform is really not sustainable. And I think this is a fantastic way to show 70+% savings while not sacrificing a bit of quality patient care. The alignment side of it, and I've said this before, and I really believe this, when what's good for the hospital is good for me. I think oftentimes there's that mentality from an independent functioning surgeon or physician of, well, why should I do anything for the hospital? Well, what's in it for me, or why should I care? Well, you should care because when your hospital is doing well, you're going to see that come back to you, maybe directly and maybe indirectly, but there is definitely a positivity occurring in a center that is successful, a center that is making cuts, that is letting people go, that can't expand capital purchases. That's not a facility that's working well, and it's not a facility that a surgeon will be happy in. So the alignment piece is really key from a lot of aspects. Am I surprised by the way the staff has responded? I am not. The staff that we have identified to be a part of this initial piloting phase, we knew what kind of staff they were. They are hard workers. They are very easy to get along with. These are people who are coming in early on days we request, that are rearranging some of their schedules to make sure that we are efficient, we are happy, and that we're taking care of patients. I think that the only thing that has surprised me is how willing they are to engage in this process. I think, again, change is difficult, and it invites a lot of questions and a lot of, what does this mean for me? How much is this going to change? Do I have to do more work? I specifically asked one of the circulator nurses, who I think is one of the best I've worked with. After our first case together, she took over the role of running some of our navigational equipment, which has been delegated to either that company's representative, which can be costly. I asked her if she felt like she did additional work that day, and she said no. I said, I think everything went really smooth and well, and I said, I agree, but that's exactly the process. We are matching your talents with new expectations, and I think we're seeing people realize that they have been underutilized, that we've fallen into that cookie cutter process that exists in so many places. Yet we're starting to let these people's talents show in other areas, And I think it makes them happier. I think people like that validation in their job. They want to come to a place where they know, hey, I have more to give, and you know what? We're going to expect that, and we love it, and we're going to reward you for it. Alignment. You know, it's kind of the holy grail of surgeons and hospitals finally working toward a common goal and not being employed. I mean, when you employ a surgeon, when a hospital does, you theoretically align them, but that model is imperfect. I mean, you don't incentivize heavy workloads or them to necessarily be terribly efficient. Sometimes they are told what to do or how to use it, and quite honestly, a lot of surgeons don't like that. So it doesn't necessarily mean that that model is correct. Here we've taken an independent practicing physician and you've aligned them with a hospital to drive value and to reap all these different benefits out of it. So I'd say alignment is the one word definition of what we're doing.